After studying this module, you shall be able to know the biopsychosocial spiritual influences of addiction, learn the notion of substance and behavioral addiction, identify the various life substances of addiction, evaluate the effects of withdrawal conditions of addiction. In the previous module, we learnt about the meaning, causes and treatment of addiction. However, just for revision and a better orientation, a review of notion and characteristics of addiction is given in brief. The present module throws light on daily life substances and behavioral addiction. For each of the types of addiction, the substances have been classified into various categories such as stimulants, depressants, hallucinogens and inhalants. The physical, cognitive, emotional effects of substance have been stated. Also, the condition and symptoms of withdrawal from a substance or a behavioral habit have also been attempted. Considering the diversity and heterogeneity in the types of addiction, the text aims to highlight only important substances which are more common as daily life addictions. Addiction. Addiction is a complex disease. It has biological, psychological and sociological implications. It leads to chemical dependency, thereby magnifying the social and emotional problems of the victim. It is primarily characterized by loss of control due to the imbalance caused in the chemical composition. Such biochemical changes prove selfish to the brain. The brain repeats the pleasurable experiences and avoids pain, but automatic brain mechanisms do not think behavior to its conclusion and do not learn from delayed negative outcomes. Addiction is believed to be a chronic mechanism of reinforcement system and circuitry of the brain. The biological structures in the brain involved in the process of addiction primarily include the interaction among the nucleus accumbens, basal forebrain, anterior cingulate, cortex and amygdala. The interface between the frontal cortex and the reward, motivation, memory substrates formulate the addiction cycle and promotes symptoms such as perceptual errors, impulsivity and poor judgment. Since frontal lobe development continues till early adulthood, an untimely exposure to substance may lead to poor prognosis and delayed restoration of healthy behavior. Genetic endowment also bears a strong correlation with acquisition of addictive behavior. Environmental factors such as conditioning, abstinent family, moral development interact with genetic predispositions and may increase the resilience towards addictive behavior. Poor support system and dysfunctional interpersonal relationships may initiate the process of abuse and dependence. Cultural norms, social acceptability, and peer pressure may also act as strong precursors to addictive behavior. Initial exposure to strong stressors such as financial crisis, loss of loved one, and traumatization may trigger disruptive behavior. A poor self-image, self-esteem, and disrupted connection with self acts as psychological predisposers and perhaps increase the addictive vulnerability. Comorbidity with other psychiatric disorders such as depression, sexual disorders, mood disorders increases the prevalence and magnitude of the abuse and dependence behavior. Addictive behavior is typified with symptoms such as inability to persistently abstain, lack of behavior control, loss of interpersonal and occupational functioning, increased craving for the substance, and an inappropriate emotional response. Specific cognitive symptomatology includes altered judgment for cost and benefits of addictive behavior, mental preoccupation with the addictive substance, cognitive error of neglecting substance addiction as a potent cause of misery in all spheres, self-serving bias, selective attention, and memory for substance abuse. Emotional changes as a result of addiction include heightened emotional agony, greater susceptibility to stress, confusion in identification, distinguishing and expressing feelings, increased emotionality after consumption of substance, relief from negative emotional states, greater perception of positive emotional states, etc. The treatment of addiction aims at reducing the frequency of consumption, abstinence from the substance, preventing relapse, increased periods of remission, stress management during the remission periods. The treatment modalities include pharmacological therapy combined with psychological intervention with a focus on psychosocial rehabilitation. Daily life substances. Substance addiction. Substance addiction is classified as DSM-4-TR substance-related disorders, which are further categorized in substance abuse disorder and substance dependence disorder. Substance dependence may involve maladaptive pattern of substance use causing clinically significant impairment or distress over a period of 12 months as manifested by 3 or more of the signs such as tolerance for the substance, experiencing withdrawal symptoms, increased consumption of the substance, inability to control the urge of substance, heavy time and money investment in procuring or using the substance, decline in social, occupational, interpersonal functioning, and continued use of substance despite experiencing its harmful effects. On the other hand, substance abuse may also involve maladaptive use of substance causing clinically significant impairment over a period of 12 months in one of the areas such as continued substance use in case of recurrent occupational, social, financial losses, persistent use of the substance in case of anticipated physical damage and legal complaints as a result of substance use. The neurobiology of substance addiction implicates different brain regions involved in substance abuse and dependence. Reward pathways are involved in abuse of the substance and thalamus. Brainstem are engaged in causing dependence for the substance. Hence, it is quite possible to be dependent on the substance and yet not be a compulsive abuser of the same. Substance dependence or abuse can be caused by various potent substances which are broadly classified as stimulants, depressants, hallucinogens, prescription drugs and inhalants. Each of the categories involve substances that produce desired effects on the brain. Some of the substances are legal drugs, given acceptance by the law for purchase and consumption such as alcohol, caffeine, etc. Whereas some are illegal drugs and not consented by law for purchase or consumption such as heroin or cocaine. First, stimulants like alcohol, caffeine, nicotine, cocaine, etc. Stimulants, as the term suggests, produce physical and cognitive stimulation or arousal to the brain. The short-term effect of stimulant increases alertness, attention, blood pressure, pulse and respiration. However, long-term effects can be dangerous, which may lead to strong addiction, irregular heartbeat and respiratory diseases. Initially, stimulants were used to treat physical and neurological ailments, but its medical use has now declined. In recent times, it is only used to treat ADHD or depression when other treatment modalities seem to have failed. Stimulants are of various types such as: first, alcohol. The most common stimulant used is alcohol, which involves ethyl alcohol, widely used in beverages. Alcohol produces pleasantry effects and alters the filtration process of the brain. It impacts the information processing capacity, slows down mental functioning, slurs speech, increases emotionality, establishes poor motor control, reduces physical and cognitive inhibitions. The personal and social consequences are also equally hazardous. Many of the abusers experience divorce, unemployment and exercise domestic violence. It does not take much when social or occasional drinking turns into a drinking problem or addiction. The symptoms that define the line of distinction are developing tolerance of the substance, experiencing withdrawal symptoms in case of absence of the substance, engaging with legal problems because of alcohol, losing control over drinking, giving up important activities as a result of alcohol use. Dealing with alcohol addiction involves use of medication, intense counseling and therapy, use of support groups and rehabilitation of the addicts. Second, caffeine. The chemical compound is found in many commonly available food and drinks. Caffeine content ranges from 4 to 160 degree micrograms in drinks. It is also present in certain pills and painkillers. The consumption of caffeine is often promoted socially. Further, negative effects result primarily from overconsumption and characterized by intoxication. DSM-4-TR describes caffeine-induced organic mental disorders, caffeinism, as involving symptoms of restlessness, nervousness, excitement, insomnia, muscle twitching, and gastrointestinal complaints. It acts as a stimulant to central nervous system, and its regular use can cause mild physical dependence. It follows the ingestion of caffeine containing substances such as coffee, tea, cola, and chocolate. The symptoms of withdrawal include headache, low mood, irritability, anxiety, and concentration problems. Third, nicotine. Alkaloid nicotine is the chief active ingredient in tobacco. It is found in items such as cigarettes, chewing tobacco, and cigars. Nicotine dependence syndrome is observed widely and majorly amongst adolescents. It is observed that nicotine stimulates the brain reward pathways in the circuitry that initiates the pleasantry effects in the brain. Also, it is found to increase the levels of dopamine which regulate the emotional levels. Nicotine smoking spreads instantly within 10 seconds or inhalation and dissipates also quickly, as a result of which the addict has to increase the amount of substance to maintain the desired effects. Diagnostic criteria for nicotine addiction involves daily increased use of nicotine for at least several weeks. The following symptoms after nicotine ingestion is stopped or reduced, such as craving for nicotine, irritability, frustration or anger, anxiety, difficulty concentrating, restlessness, decreased heart rate, and increased appetite or weight gain. Other withdrawal symptoms include headache, decreased metabolic rates, tremors, impairment of performance, etc. The withdrawal symptoms continue usually for several days to several weeks. However, timely interventions via programs, social support, self-direction, and other cognitive behavioral strategies prove helpful. Fourth, cocaine. Cocaine is an extremely addictive drug categorized as a high-risk dependency and abuse stimulant. The effects of cocaine depend on the method of ingestion. It can either be snorted, that is through the nose, or mixed in water or directly ingested through the veins. The common form of street cocaine used is called crack, which is generally inhaled with pipe. The use of cocaine, like other addictions, stimulates the reward pathways of the circuitry and increases the available dopamine levels in the brain. With the recurrent use of substance, the addict develops a tolerance and tends to use greater amount of the substance to have pleasantry effects. Cocaine, when used with other drugs such as amphetamine or marijuana, produces all the major physical and psychological hazardous effects. The symptoms of cocaine addiction involve irritability, restlessness, headache, anxiety, paranoid psychosis, hallucinations, mouth ulcers, or even severe tissue damage. The effect of cocaine addiction involves vulnerability to heart attacks, strokes, metabolic disorders, respiratory disorders, skin allergies, and in severe cases it can prove fatal as well. The treatment focuses on complete abstinence, relapse prevention, and rehabilitation of the addict. Second, depressants such as benzodiazepine, barbiturate, heroine. Depressants are substances that produce inhibition in central nervous system. As a result, it leads to drowsiness, increased inhibitions, slowness, sleep, etc. They are also called downers as they slow the brain process, alter perception, produce attention and memory deficits, fatigue, heart rate, etc. Withdrawal symptoms of depressants include delirium, weakness, insomnia, confusion, hallucinations, seizures, etc. Commonly used daily life depressants are benzodiazepine, barbiturates, and heroine. Benzodiazepine. It is one of the oldest form of tranquilizers given to treat problems such as anxiety, insomnia, psychosis, muscle relaxation, and to enhance anesthetic effects. The drug is available with familiar names such as diazepam, lorazepam, Xanax, etc. This drug generally acts on the central nervous system and slows down the brain activity, produces sedation and reduces anxiety. The symptoms of addiction include developing tolerance for the drug, experiencing withdrawal symptoms, increasing the amount of substance consumed, etc. Excessive use of the drug may involve confusion, weakness, drowsiness, judgmental errors, respiratory diseases, poor psychomotor coordination, slurred speech and blurred vision. In spite of useful effects of the drug such as relaxing and calming, the addiction of drug produces harmful effects. The addict person generally denies the addiction and suffers with psychological dependency than physical dependency. The treatment of addiction involves medical intervention with the use of antidotes such as flumazenil. Gradual withdrawal and prevention of seizure remains at the focus of treatment. Use of rehabilitation centers in case of chronic cases can prove helpful. To overcome the psychological dependency, cognitive behavioral therapy is widely suggested. Barbiturate. This type of drug falls under sedative hypnotic class of medicines and are usually available with names such as downers, goofballs, yellow jackets, etc. These medicines were initially used by doctors to produce relaxation and improve sleep disturbances. But with the heightened use of drug, they realize that it produces effects similar as coma or death. Since the use of the drug was restrained and was replaced by benzodiazepines. The drug works by enhancing the functioning of inhibitory neurotransmitter GABA, which then relaxes the brain and calms the body. The symptom of addiction includes tolerance, impaired judgment, confusion dependence, psychosis, blurred vision, slurry speech, hypertension, poor motor coordination, irritability, depressive mood, respiratory problems, etc. The long-term effects of the drug include interpersonal relationship problems, seizures, attention and memory deficits, coma, liver disorders, heart problem and death as well. The withdrawal symptoms include delirium, convulsions, irritation, anxiety, sleep disturbances, hallucinations, general weakness, etc. Detoxification and gradual withdrawal from the substance combined with cognitive behavioral therapy may prove as an effective treatment plan. Heroine. Just as barbiturate, heroine is also considered as a downer which works in the same fashion and produces a relaxing effect in the brain. It also produces euphoria and blocks the ability of the brain to sense pain. The consumption of heroine can be through snorting, drinking or injecting. The initial signs of heroine consumption at home can be traced through excessive purchase of needles or syringes, plastic bags with residue, aluminum foil with burn marks, etc. The signs of heroin abuse include increased sleep, drowsiness, decreased attention, memory loss, lack of motivation, decreased self-esteem, disorientation, dry mouth, weight loss, runny nose, amenorrhea in case of women, etc. The side effects of heroin dependence involve delirium, depression, heart problems, blood clots, pulmonary diseases, seizures, liver disorders, etc. The treatment of heroin addiction is not suggested at home but rather at rehabilitation centers where detoxification, abstinence, relapse prevention can be appropriately seen. Third, hallucinogens like ecstasy, LSD, PCP. Hallucinogens are extracts of plants which have been religiously and ritualistically used. They contain nitrogen classified under alkaloids which resemble the structure of original neurotransmitter such as serotonin, acetylcholine. It works by binding the receptors of the imperative neurotransmitter in the brain and produce psychedelic effects. Excessive use of hallucinogen drugs lead to perceptual distortions, emotional irregularities, cognitive deficits and physical damage. Common hallucinogens used are ecstasy, LSD and PCP. Ecstasy. The drug is both a hallucinogen and a stimulant popular among young adults. It was patented in 1913 and further evaluated and tested during 1970s and 80s as a potential medication for the use and treatment of wide range of psychological conditions. The drug, in combination of MDMA, an acronym for methyllenidioxymethamphetamine, and other adulterants such as caffeine, cocaine and methamphetamine, it is an illegal drug and exhibits both stimulant and psychedelic properties. The drug works by altering the working of neurotransmitters serotonin and norepinephrine in the brain. Ecstasy has been associated with personality characteristics of impulsivity and poor judgment. Such users have been found to be more likely to use marijuana, engage in binge drinking and smoke cigarette and have multiple sexual partners. Literature reports negative psychological and health consequences of using ecstasy. Further, the use of ecstasy has been found to be associated with memory impairment, irritability, aggression, sleep disturbances, reduction in mental abilities, etc. LSD. It is one of the most common mood-altering drugs. It was found in 1938 and is obtained from lysergic acid, fungus stuck at rye or other plants. It is generally sold in tablets, capsules or liquid form and is thus consumed orally. The effect trips are generally stayed for 12 hours followed by deep sleep at times. It also impacts the serotonin levels in the brain, controlling the behavioral, perceptual and regulatory system of the body. The psychological effects of LSD are stronger than physical signs. Delusion, visual hallucinations, emotional swings, multiple sensations, perceptual confusion are common signs of LSD abuse. The physical side of using LSD involves dilated pupils, increased heart rate, hypertension, weight loss, tremors, sweating, etc. PCP. It is a white crystal powder easily soluble in liquids. It is easily found in form of tablets, capsules and powder form which can be snorted, smoked, orally consumed or intravenously injected. It has a bitter chemical taste and is often mixed with leafy material for its consumption. Its effect stays for 4 to 5 hours. It has initially used as strong anesthetic but later discontinued because of its hazardous effects. It is considered to be a dissociative drug as it severely alters the perception and causes depersonalization at times. Use of PCP causes symptoms which are similar to schizophrenia at times, such as hallucinations, delusions, paranoia, memory loss, mood swings, attention deficits, speech difficulties, etc. Long-term use of PCP includes breathing difficulties, sweating, numbness, nausea, vomiting, loose motor coordination, seizures, coma, etc. Development of anti-PCP antibodies and behavioral intervention supports the treatment modality for the abuse of PCP. Fourth, inhalants like nail polish, glue, eraser, fluid, gasoline, etc. Inhalants are referred to as wide variety of substances such as solvents, gases, aerosols, nitrites, which are consumed only through inhalation or snorting with the nose. Various daily life substances such as paints, fluids, petrol are generally inhaled. The abuse of such substances is more by the adolescents and teenagers. It works by slowing down the central nervous system and produces physical, emotional and cognitive errors. Key signs of inhalant abuse include euphoria, dizziness, slurred speech, poor psychomotor coordination, hallucinations, delusions, etc. Repeated excessive use of inhalants may result in poor inhibitory control, confusion, drowsiness, nausea, etc. With the recurrent use of spray paints, dewaxers, hearing loss may emerge as a very significant effect. With the abuse of gasolines, peripheral neuropathics of feet and hand and susceptibility to brain damage may increase. Liver and kidney damage may emerge from sniffing of fluids and erasers. Depletion of blood oxygen may come as a result of inhaling nail polish removers, varnishes or paints. Brain and lung hypoxia may center as a common symptom of any kind of inhalant abuse. Depletion of myelin protecting nerve fibers also occurs as a result of inhalants abuse. Inhalant treatment focuses on dealing with intense withdrawal symptoms, prevention relapse, reducing tolerance, and establishing psychosocial rehabilitation of the addict. Behavioral addiction. Behavioral science experts pose that any activity which can potentially stimulate a person can truly turn up to be addictive. The development of such addiction begins when a normal social action transcends into obligatory behavior. The idea of addiction in absence of any psychotropic drug or chemical substances was introduced by Peel in 1979. According to Peel, an addict is primarily dependent on a particular set of notions and experiences to which response to a specific psychotropic substance may be just an example. Behavioral addiction is different from substance addiction in a way that no substance is ingested by the body. However, the person gets addicted to certain set of behavioral responses. The examples would include gambling, eating, or exercise. Behavioral addiction was recently included in two main classification systems of DSM-4 and ICD-10, which emphasizes on functional impairments to be essentially present in occupational, interpersonal, and social areas. Other characteristics as defined by Goodman should be present for at least 1 month and include persistent uncontrollable impulse to engage in specified behavior, increasing anxiety before the initiation of behavior, relief after engaging in behavior, a sense of uncontrollability and inability to stop the behavior. The most common types of behavioral addiction have been mentioned, such as first, gambling addiction. Also understood as compulsive gambling, it is a dysfunction related to impulse control. It is a preoccupation with gambling content irrespective of financial, vocational, or relationship losses. Some of the serious problems that this type of addiction poses is that gamblers tend to gamble secretively and also in the absence of required resources. They have trouble controlling the impulse and it becomes a major cause of worry for the family and significant others. Treatment for such gambling has to be extremely customized for each of the unique patients. Cognitive behavioral therapy serves as the best modality in association with family therapy. It aims to restructure the underlying dysfunctional beliefs, helps the patient deal with painful emotions, develop stress coping strategies, and resolve deep-seated interpersonal problems. Second, food addiction, also known as compulsive overeating, uses food to deal with uncomfortable and painful emotions. It is very similar to any kind of drug or alcohol addiction where chemical reaction in the brain is triggered by a food item rather than any substance. This type of addiction manifests in having uncontrollable urges or cravings for a particular food item or a specific amount of food. As in alcohol or any other substance, after consumption, individual feels a high which in turn reinforces the person to consume more of the substance. Similarly, in case of food addiction, consumption of specific type of food, commonly sugar, chocolates or rich in carbohydrates, gives an emotional high and maintains the vicious cycle of addiction. The broad symptoms of this particular addiction involves inability to control craving for a particular type of food item or the amount, consuming the amount till feeling uncomfortably full, eating food secretively, feeling guilty after eating but yet helpless in controlling eating when not hungry, excessive concern or worry for a food item craved to be present or in less than desired amount. In all, food addiction impacts physical, social, psychological and emotional well-being of the individual. Third, sex addiction. The main feature of this type of addiction involves an intense need to take part in sexual activity. This uncontrollable urge may get instigated by watching many hours of pornography. This may further urge the person to have instant sexual gratification either by masturbating or by engaging into a sexual act online or at public places as well. Such promiscuous activity can lead to physical and psychological harm to the individual. The major symptoms of sexual addiction involve compulsive masturbation, large collection of sexual material, investing lot of time in watching pornography, engaging in sex with multiple partners, spending lot of money in prostitution, voyeurism, or watching others having sex, engaging in rape or molestation, engaging in cyber sex, having multiple one-night stands, etc. Another characteristic feature of this unique type of addiction is that individual experiences a lack of bond with the partner involved and treats her as a sexual object. The consequences of addiction involve financial losses as a lot of money is involved in prostitution, health compromises as many of the addicts suffer with STDs or AIDS, emotional pain of feeling helpless with addiction associated with guilt, social deterioration and poor social interactions. Fourth, internet addiction. The increasing engagement with the virtual world than the real world has been a cause of concern for almost everybody. The use of internet can be constructive and destructive as well. It may seriously interfere with everyday functioning, work and social relationships. Internet addiction involves various forms such as cyber sex addiction, net compulsion, maintaining cyber relationships, over-engaging in internet gaming, etc. The symptoms of internet addiction include no track of time invested on use of internet, inability to prioritize work and reduced work productivity, decrease in social interactions, poor occupational functioning, feeling of guilt for such irrational behavior, feeling of anxiety before engaging in the activity and relief after continuing the activity. Physical symptoms include backache, postural problems, dried and strained eyes, sleep disturbances, profound weight loss or weight gain. Various risk factors identified for internet addiction include loneliness, stress, anxiety, depression, history of any other kind of addiction, lack of support system, etc. The treatment for this addiction focuses on counseling, targeting interpersonal issues, support groups, building stress coping strategies, etc. Work addiction, often referred to as workaholism, manifests as an intense persistent need to engage in work. The individual may not necessarily occupy oneself with work out of any monetary or success rewards but rather psychological need to work. It may also be viewed as a compulsive behavior to counteract the obsession with work to an extent that person develops anxiety when he or she is not working. As a consequence, they tend to keep working irrespective of the nature of work and its quality. Many times it has been seen that work addicts tend to lose their job as they do not focus on a particular task and keep shifting from one set of work to another. A work addict generally denies that he suffers from a problem but rather accepts it as job pressure or ambition to grow professionally. The common symptoms of addiction include persistent preoccupation with work, constant inability to remain calm and relaxed, work in spite of excessive fatigue or ill health, strong inability to trust subordinates for work, no space for rest or time to eat. The effects of work addiction are quite serious. Significant loss of physical health is commonly seen with addicts. Loss of interpersonal relationship emerges as the addicts is not able to give quality and quantity of time to it. Emotional effects such as low mood, irritability, guilt, frustration, anxiety take a toll. Stress appears to be the most common effect of addict, seems to be stressed out always of the unfinished task and the next task to be accomplished. The treatment on this type of addiction includes use of medication to treat anxiety as similar to obsessive compulsive disorder, thought pattern and cognitive behavioral therapy to challenge the underlying causes of self-esteem and self-worth. Sixth, exercise addiction. This type of addiction is commonly associated with the increase in the cosmetological appeal. It entails excessive or compulsive exercising, which may also prove hazardous for physical and psychological health of the individual. The identifying feature of this type of addiction is persistent preoccupation with the mental content of exercising. Also, the inability to concentrate anywhere else merges as a significant sign. Many addicts tend to pay a heavy cost for exercising in terms of financial debts, poor work performance, and irregularity at work. Significant loss of personal relationships and poor social performance as a result of excessive time spent in exercising is another common symptom. Inability to exercise with others manifested as an effect of disturbance in the own exercising regime also marks it as a different form of regular or non-compulsive exercising. Comorbidity with eating disorders such as anorexia nervosa or bulimia nervosa is very closely observed with such addicts to an extent that many times this addiction is also referred to as anorexia athletic. The effects of such addiction have serious consequences on physical and psychological health of the addict. Some of the serious physical effects include excessive fatigue, sleep disturbances, joint damage, stiffness in the muscles, loss of muscular weight, reduced bone density, and irregular menstrual cycle in women. The psychological effects include cognitive errors, attention and memory biases, increase in anxiety if not able to exercise, low mood, body image disturbance, and low self-esteem. The treatment for this type of addiction does not include use of prescription drugs but rather psychotherapy aiming to deal with underlying strong issues of poor body percept, low self-esteem, anxiety and interpersonal conflicts. Family support is viewed to be a strong predictor of prognosis with this unique addiction. 7th, gaming addiction. A special focus on video gaming addiction has been not to recognize as mental illness by American Psychological Association. However, its symptoms and effects have been observed quite similar to work or sex addiction. One of the key features of addiction is the increase in the threshold of satisfaction after playing. This threshold seems to keep increasing and the individual tends to play more and more to achieve the level of satisfaction. Increased arousal, irritability and anxiety in situations where one is unable to play has been observed as important symptoms. Preoccupation with the idea of gaming and no track of time invested lies at the epicenter of addiction. The other common symptoms include sleep disturbances, loss of interpersonal relationships, lack of social interest, sudden significant weight gain or loss, poor academic or work performance, mood swings, etc. Such kind of addiction seems to seriously affect the physical health in terms of causing excessive fatigue, neurological problems, numbness in hands and foot, postural problems, etc. The psychological effects include cognitive deficits, poor judgment, slowness in information processing, forgetfulness, increase in violent behavior as a result of playing violent games, inability to concentrate, avoidance of family and friends as well. The treatment involves counseling and behavior modification to target underlying anxiety, substituting it with constructive behavior and enhancing the ability to deal with stress. 8th, shopping addiction. Shopping is considered to be as favorite pastime especially for women, but many times it tends to become pathological as well. As also commonly referred to as shopaholic, the individual engages in persistent shopping despite of serious negative consequences. Since it also conforms to the societal norms and is considered to be a sign of prosperity, it becomes difficult to identify it as an addiction. It manifests itself as any other addiction where the person seems to get preoccupied with thought of shopping and is unable to control despite of significant losses. Feeling of helplessness where the addict knows that it is wrong but still continues to exhibit shopping behavior creates a lot of stress on the addict. The other symptoms include shopping of items which are not required, shopping even in financial debts, hiding shopping activates manipulating bills and accounts, feeling of lowness when not being able to shop or alter shopping, constant conflict with family over the issues of spending more than required, etc. Shopping is believed to have a pleasantry effect and perhaps gives an emotional boost to the addict. Perfectionism, depression, anxiety may fuel the damaging behavior. The effects of addiction involve significant financial debts, poor interpersonal relationships, avoiding social engagements because of no time from shopping, etc. The treatment involves intense counseling and psychotherapy to deal with underlying tough emotions. A significant difference in treatment of this addiction is that complete abstinence, like an alcohol or drug addiction, can't be achieved, as shopping is an integral part of life. However, with treatment of the addict may learn the act of shopping and may not use it as compensatory or escaping behavior to deal with intense emotional conflicts. Summary. First, addiction can be defined as primary chronic disorder of brain reward motivation of the circuitry system. Disruptions in such areas may lead to socio-spiritual disturbances which may clinically affect the adaptation of the individual. Second, the process of addiction in the brain starts with disturbed interactions among the nucleus accumbens, basal forebrain, interior cingulate cortex and amygdala. Addictive behavior is typified with symptoms such as inability to persistently abstain, lack of behavioral control, loss of interpersonal occupational functioning, increased craving for the substance, and an inappropriate emotional response. Third, addiction can be classified as substance addiction and behavioral addiction. Substance addiction includes substances-related disorders which can further be categorized as substance dependence or substance abuse disorders. Behavioral addiction includes addiction towards a behavioral response such as gambling, games, shopping, etc. Various daily life substances that can cause addiction can be classified into stimulants, depressants, hallucinogens and inhalants. Stimulants produce physical and cognitive stimulation or arousal to the human. The short-term effect of stimulant increases alertness, attention, blood pressure, pulse and respiration. Daily life stimulants causing addiction are alcohol, caffeine, nicotine and cocaine. Depressants or tranquilizers work opposite of the stimulants and produce inhibitory and relaxing effects in the brain. Common depressants used are benzodiazepines, barbiturates and heroine. Hallucinogens are extracts of plants which contain nitrogen classified under alkaloids that resemble the structure of original neurotransmitter such as serotonin, acetylcholine. The capacity to produce hallucinogenic and psychedelic effects. Common hallucinogens used are ecstasy, LSD and PCP. Inhalants include wide variety of substances such as solvents, gases, aerosols, nitrites which are consumed only through inhalation or snorting with the nose. Various daily life substances such as paints, fluids, petrol are generally inhaled. Abuse of inhalants involve euphoria, dizziness, slurred speech, poor psychomotor coordination, hallucinations, delusions, etc. Behavioral addiction is different from substance addiction in a way that no substance is ingested by the body. However, the person gets addicted to certain set of behavioral responses. Symptoms of behavioral addiction may involve persistent uncontrollable impulse to engage in specified behavior, increasing anxiety before the initiation of behavior, relief after engaging in behavior, and a sense of uncontrollability and inability to stop the behavior.